Welcome to Monday's edition of COVID-19. The daily tally has been hovering high this past weekend, and while we're starting the work week with a slight decline in cases, healthcare pundits are bracing for concerning rebounds this week. And this grim outlook is being shared with neighbouring countries, including China and India. Now, we have details on that later on the programme. Here first is the broader coverage with our Kwon So-ah. Now, So let's begin here on the local front then.
All right, Sunny, the new work week is not starting off on a bright note. Close to 1,500 cases were reported as of 12 a.m. this Monday, and that includes 1,455 domestic transmissions and 37 cases from abroad. And that has raised Korea's total to 212,448 infections. Now, this past Saturday and Sunday, we had the highest daily caseloads ever for the weekend, and we do have almost 240 fewer cases compared to yesterday, but nevertheless, 1,492 is the highest figure we are having for a Monday figure since the pandemic broke out here in Korea. So it is difficult to say how the situation is going to develop throughout this week, but so far, this is how health authorities are assessing the situation.
Infections in the capital region are gradually declining, and the spread in the non-capital regions is also slowing down. But in places like Daejeon, the Chungcheongdo provinces, Busan, Gyeongsam-namdo province, and Jeju Island, infections are continuing to rise. It is slightly disappointing, but some progress is also being observed.
And this Monday, we are starting off with over 400 cases in both Seoul and Gyeonggi-do province, also a triple-digit figure here in Busan. Meanwhile, apart from Sejong City, the rest of the nation all is seeing at least double-digit figures.
Right, and given that reality, so social restrictions have been extended starting on this Monday, while vaccine reservations for those aged between 18 and 49 begin later on this Monday also.
That's correct, Sunny. So beginning this Monday until the 22nd this month, so for 2 weeks, the capital region, which means Seoul, Incheon, and Gyeonggi-do province, as well as Daejeon, will be under the highest social distancing measures, whereas the rest of the nation will be under level 3. But Busan also decided to raise its level to level 4. That is expected to kick off on Tuesday, but also until the 22nd of this month. And that also means that the port city will close all of its beaches during that period. Now, as Sunny mentioned, vaccination also booking for some 16 million citizens aged 18 to 49 kicks off at 8 p.m. this Monday. Now, they are expected to receive their first dose of either Pfizer or Moderna shots from late August until September 30th. Now, due to the large amount of people eligible for this reservation and vaccination, they will follow a 10-day rotation schedule. So for a closer look now, applications are to be made according to the last digit of one's birth date. So on this 9th, when the reservation kicks off, people born on the 9th, 19th, or 29th of any month will make their reservations from 8 p.m. until 6 p.m. the next day. Now, people who missed the chance to make their reservations during this 10-day period have 3 additional days to do so, and that will be divided by age group. Now, meanwhile, the nation has vaccinated 20.9 million with at least 1 dose, and also 7.7 million people, or 15%, are fully vaccinated. Let's move on to international updates. In Japan, the number of coronavirus cases has jumped by 3.4-fold, so more than tripled from the opening of the Olympics until the closing ceremony. So especially that being due to the surging Delta variant cases. Now, on July 23rd, Japan had some 4,200 infections, but on August 8th, on the closing day, the capital Tokyo alone recorded over 4,000 cases, and the entire country more than 14,000. Also, at least 436 infections were directly linked to the Olympic Games. And last but not least, let's check some of the numbers abroad. Over the weekend, some countries have made some milestones when it comes to total infections. The UK hit 6 million cases and Argentina 5 million. And Iran is seeing one of the worst situations here at 4.1 million, recording almost 40,000 infections in the past day. And the total number of cases around the world stands now at 203.4 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, in related news, imagine the presence of an oral drug for COVID-19, one that can be taken within the comfort and convenience of one's home in the absence of medical assistance, as is the case with intravenous drugs. Up next, we share with you the progress thus far on efforts to develop a pill against the pandemic.
Amid the spread of the Delta variant and experts warning that COVID-19 could become an endemic disease, drug makers are now experimenting with new antiviral therapies that can be taken orally. For its part, the Biden administration in the U.S. has pledged to invest $3 billion for the development and production of antiviral pills. U.S. pharmaceutical giant Merck has already signed a deal to supply 1.7 million doses of its experimental antiviral pill known as molnupiravir.
몰누피라비르라는 약은 코로나 환자를 대상으로 한 경구 치료제로 개발되고 있는 약입니다. 약이 작용하는 기전은 코로나 바이러스가 복제되는 과정 가운데 복제 과정에 오류를 일으켜서 바이러스가 죽도록 하는 그런 기전으로 작용하는 약입니다. 1,550명 정도의 외래 환자를 대상으로 한 3상 임상시험을 진행 중에 있고요. 해당 임상시험 결과는 올해 가을쯤 확인할 수 있을 걸로 예상하고 있습니다.
Currently, remdesivir and Rekirona are the only COVID-19 treatments that have been approved by Korea's drug regulator, with both being intravenous drugs that must be injected using a syringe.
주사제, 경구제 이거는 개발하고자 하는 물질의 성질에 따라서 결정되어지는 건데요. 대부분 주사제가 개발하는 과정에서 다루기가 좀 쉽습니다. 그래서 이제 주사제를 보통 많이 시작할 단계에서는 주사제로 많이 개발을 하고요.
Compared to intravenous drugs which are delivered directly into the bloodstream, it is comparatively more difficult for pills to be absorbed by the body, as it has to pass through the digestive tract. In spite of this disadvantage, pills provide far more convenience and comfort and can be taken at home without any medical assistance.
몰누피라비르 같은 경우는 따로 이 약을 투여받기 위해서 병원에 입원하거나 오는 특별한 어떤 의료기구 같은 게 필요하지 않습니다. 그렇기 때문에 이 약을 통해서 환자분들이 쉽게 코로나에 대응할 수도 있고요. 또 지금처럼 팬데믹 상황에서 여러 가지 상황을 대응하는 데 도움이 될 걸로 예상을 하고 있습니다.
신종플루 치료제, 타미플루의 사례로 봤을 때 이 같은 접근성의 확대는 코로나19를 억제하는 데 큰 효과를 발휘할 것으로 보입니다. 또 경구용 치료제의 경우에는 보관이라든지 유통이 굉장히 용이하기 때문에 개발도상국 등 그 전 세계에 더욱 효과적으로 이제 공급이 가능해질 것입니다.
Local drug makers have also entered the global race to develop a COVID-19 treatment pill. According to Korea's drug regulator, a total of 13 COVID-19 treatment candidates are currently undergoing clinical trials, including several in the form of tablets and capsules.
그간 축적해온 신약 개발 노하우라든지 R&D 역량으로 볼 때 우리나라도 경구용 치료제 개발 역량과 성공 가능성이 충분히 있다고 봅니다. 정부도 적극적으로 개발을 지원하고 있기 때문에 만약 이상 결과가 좋으면 조건부 허가라든지 긴급 사용 승인을 통해서 그 시기를 상당히 앞당길 수 있을 것으로 기대를 하고 있습니다.
With experts now saying that SARS-CoV-2 and its variants could become endemic viruses, these new pills could play a key role in overcoming the limitations of vaccines.
전쟁에서 무기는 여러 개가 있을수록 좋습니다. 예방약은 예방약대로, 치료제는 치료제대로, 그런 치료제들이 아주 중증 환자한테 쓰이는 치료제, 경증 환자한테 쓰이는 치료제, 이런 다양한 치료제가 있다 본다면 질병 치료에 굉장히 큰 도움이 되겠죠.
With vaccines still in short supply in many parts of the globe, coupled with the emergence of new variants, COVID-19 treatment pills could be a game changer in our fight against the pandemic.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday. And while we wait for that to start, let's take a quick look again at the inoculation appointment timetable for those aged between 18 and 49 here in the country. Now, as our source mentioned earlier, online reservations are poised to begin at 8 on this Monday evening, and those eligible are people whose birth dates end with 9, which coincides with today's date, which is the 9th of August. Now, these individuals have between 8 p.m. on this Monday until 6 p.m. tomorrow, that is Tuesday, to make their COVID-19 vaccination appointments. Then tomorrow evening, that is Tuesday, the 10th of August, those whose birth dates end with 0 are eligible for their bookings. Now, authorities have also allowed for late registrations, that is, for the 19th, 20th and 21st of August, for those who happen to miss their registration dates. Meanwhile, social restrictions have been extended for 2 more weeks until the 22nd of August. Level 4 restrictions are in place here in the Greater Seoul area, as well as a few other regions that have been recording an uptick in cases, including Busan, which will see levels rise up on tomorrow, that is, the Tuesday. Up to 4 people are allowed to meet for social purposes until 6 in the evening, and after that, 6, that is, only 2 people can do so. This cap on gatherings also extends to family members who reside together. Meanwhile, events including weddings and funerals can only see a maximum of 49 people in attendance, and only one-person rallies are permitted. Also, under this level, the academic arena needs to adopt remote learning. Workplaces, for their part, need to ensure that 30% of their workforce is working from home. Sports stadiums can host no spectators, while outdoor sporting facilities face a cap on the number of players. Hotels and other accommodations are required to operate at 2/3 of their capacity. Places of worship can have 10% of their capacity open to on-site worshippers, but they may not exceed 99 people. Nightlife entertainment businesses, including bars and clubs, remain shut, while restaurants, cafes, gyms and concert halls are required to close doors at 10 in the evening with strict protocols in place with regard to seating arrangements, ventilation, face masks and visitor logs. Now, for those under level 3 restrictions, the cap on small gatherings remains the same. That is, a maximum of 4 people can meet socially. Events including weddings and funerals, as well as rallies, can have up to 49 people in attendance. Right, to understand the briefing has started. We'll come back to you afterwards.
We will be providing you first a briefing on the vaccine supply.
안녕하십니까?
Good afternoon. I am the head of the TF team for the vaccine supply. I am Health Minister Gov'T. Here are some updates on our vaccine supply schedule. The government is currently aiming to secure enough vaccines, and we have also secured the securing of the contract for about 190 million doses of the COVID-19 vaccines. And right now we have finished the supply and the arrival of about 35 million doses of the vaccines, and we have been providing these vaccine doses to our people. However, we have seen some supply issues of Moderna, and about 8 million doses from Moderna, we will be having to cut the supply within the August to half, and we have been notified of this by Moderna. And Moderna has said, and they have also apologized for Korea for such inconvenience, and said that this is a global supply issue, and they also vowed to exert their full efforts to supply more vaccines going forward. And the government, the South Korean government, has also criticized, and we have also urged the company to provide us with the vaccine as soon as possible. And right now, globally, we are also seeing a shortage of the vaccines due to a large increase in the demands, and due to this, we have had some changes in the adoption of the mRNA vaccines roll out here in South Korea. And taking this opportunity, the South Korean government will make sure that we elevate any inconveniences, and we make sure to also inoculate our citizens going forward. And we will also conduct continuously the regular meetings with the Moderna, the high executives of Moderna as well. And we will also secure the safety of Moderna vaccines, and we will also seek new measures. And we are also supplying and exhorting our full diplomatic efforts as well. And we are also having a Korean official team dispatched to the site, which will be headed by the Vice Health Minister. And we will also urge the company to supply South Korea with COVID-19 vaccines as soon as possible. And I would like to first of all apologize to the public for such inconveniences that have been resulted. And going forward, we will also continue to have negotiations with Moderna, and we will provide you with the details of the vaccine supply schedule, and we will be disclosing the details to the scope that we can going forward. And to this end, we sincerely hope and we will exert our full efforts to make sure that our public can return to a pre-pandemic routine. Next, we will have the commissioner of the KDCA who will be explaining us about the vaccine rollout schedule. I am the commissioner of the KDCA, and let us now begin our regular briefing for August 9th. And we will have some details on the vaccination rollout for months of August and September. And as you just heard, we have had a decline in the supply of vaccines to be supplied from Moderna within August, and we will also temporarily extend the interval of the mRNA vaccine doses to 6 weeks. However, we are currently rolling out the vaccines to those in the 50s, and also the third round of the local autonomous vaccinations will be carried out as scheduled. And moreover, the vaccination reservation between the ages of 18 and 49 will be carried out as scheduled starting from 8 p.m. today. And also after the 16th of August, who are eligible for the second dose of the mRNA vaccines, they will be having the interval of 6 weeks, and this will continue until September. And as for the test takers of the college entrance exam and also high school seniors and faculty members, we will be carrying out the plan as initially planned, so that we have no changes made to our plan for these group of people. And as for the details, we will be providing the updates and notifications for the individuals. And currently, we have been carrying out the vaccine doses, vaccination of the first dose for those in their 50s until the 28th. And starting from next week, we will be providing Pfizer vaccines for these group of people in the metropolitan area, and Moderna for those in other regions. And the eligible people will be receiving individual text messages as well. And as for the third round of the local autonomous vaccination program, which is targeting at the age group of 18 and 49, we have about 1.35 million people who have completed the vaccination booking process, and we will be rolling out the vaccines, Pfizer vaccines for this group of people as scheduled at designated vaccination centers. And as you know, we will begin our vaccine appointment booking for the age group of 18 to 49, that is, and we will have a 10-day rotation system, and also the booking will begin on every 8 p.m., which will continue until 6 p.m. the following day, and they will also have designated dates depending on their last digit of birthday. And this means starting from today and until tomorrow's 6 p.m., those whose birthday end with 9 will be eligible to make their bookings. And starting from this process of the bookings, they need to also, first of all, have the personal identification process. So you need to, at least a day before your vaccination booking date, you need to download these authentication first through the applications including Kakao, Naver, and Pass in order to alleviate any discomforts and inconveniences. And please also avoid 8 p.m., which we see that many people will be connecting to the server. However, we could also have some changes made to our vaccination plans going forward, so we will be providing these details going forward. And in the month of August, we will also expand the scope of those eligible recipients who will be able to get the vaccination, the surplus vaccinations going forward. And this is aimed at expanding the scope of people so that more people can receive such vaccines going forward. And also at the designated hospitals, we will have the hospitals give out the priority groups of those who have chronic illnesses who are being treated at specific hospitals going forward. And as for those under the age of 50, we are aiming to ensure the safe vaccine rollouts. And I once again would like to apologize and ask for your understanding for the adjustment of the interval weeks of the mRNA vaccines to 6 weeks. And going forward, we will be providing details going forward, and we will make sure that the vaccination rollout is carried out smoothly going forward. Thank you very much.
그럼 질의응답 시간 갖도록 하겠습니다.
Right, that was Chong Young with Monday's afternoon briefing, and I have our Kwon-so back at the desk with a summary of that address. Right, So.
Right, Sunny. We had Kwon-Duk-cheol, the health minister himself, at the briefing today with slight disappointing news regarding the vaccination supply here in the country. There's going to be a revision to the vaccination rollout this month as Moderna, one of the two major vaccines that are going to be rolled out this month, has told Korea that it can only supply the country with around half of its earlier expected 8.5 million doses of vaccine this month for this August, and that due to issues with its laboratories, so its vaccination production. So the company has apologized to Korea, while the health minister has apologized to the nation's people for this revision. So first off, this will mean that the reservation will kick off as planned, but the interval of when to get the full vaccination doses, which is usually 2 for mRNA vaccines, will be changed to 6 weeks. And the authorities are going to make sure to file complaints and negotiate with the company Moderna to make sure that we can go ahead with our plan to vaccinate 70% of the nation's population with at least 1 dose by September.
Right. All right, So thank you very much for that.
Thank you.
지난 한 달간 하루 평균 1,500명을 넘는 신규 확진자 수가 여전히 유지되고 있습니다. 다시 한번 사회적 거리두기에 동참해 줄 것을 간곡히 호소합니다.
It's been well over a month since the start of Korea's fourth wave, and the daily tally remains well above 1,000 despite efforts to bring that figure down. Meanwhile, neighboring China is marking signs of a resurgence, as is India, where some authorities believe a third wave is taking form. And for more on the situation here and elsewhere, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
My pleasure to be here again.
And I also have joining the session virtually is Dr. Sam over in China. Welcome, Dr. Sam.
Thank you very much, Sunny. Thank you for having me again.
Right, then we'll start here in the studio. Professor Chung, Korea recorded more than 1,800 cases on Saturday and over 1,700 cases on Sunday. Now, these are record tallies for a weekend. What appears to be challenging efforts to contain this fourth wave here in the country?
Well, we cannot see when is the peak and how long this fourth surge will be going on. There are several factors that we cannot suppress this current surge. First of all, many people have lost alertness because of a long-lasting social restriction, distancing. So people are sick of keeping social distancing, or sometimes people are violating the regulation on purpose. And the other factor is the accumulation of many unknown infection sources for last 6 and 7 months. So after the surge of third wave, we had continued to have around 400 or 500 confirmed cases every day. Among them, 20 to 30% were not confirmed, the sources. So every day, several hundred patients did not know about how they got the infection from anyone. So that kind of large population have been fewer to this fourth surge. So the epidemic continues here. And the other one is the Delta virus. So the first wave started from only 12% of Delta variant among whole viruses in this country, but now it comprises of over 70% as of this week, maybe. And we'll be going up to 80% and 90% of whole viruses. So we cannot prevent the Delta from prevailing in this country. We have no vaccine so far available, and we have do not have, as others, do not have any therapeutic agent to treat the Delta virus. And finally, the level 4 we are doing is not a very strict one compared to 2.5 when you were going through a third wave. So if there is no strong restriction, regulation, there'll be no reason why we are seeing a decreased number sooner or later.
Right. And while we are fighting a fourth wave here, over in India, it appears that authorities there may be fighting a third wave this month. For more on the situation there, I also have Dr. Abdul Ghaffur over in India live on the line. Welcome, Dr. Ghaffur.
Thank you.
Right,
Good
Doctor.
morning.
Right. I'll come back to you with a question for India soon. But first, I'd like to ask Dr. Sam over in China. Now, China, Dr. Sam, is also battling the Delta variant following an outbreak that last month at Nanjing Airport in eastern Jiangsu province that has spread to at least 17 regions. Please do start with the COVID-19 situation in China.
Yeah, thank you, Sunny. Actually, that's right. Recently, China saw some sporadic COVID-19 infections in multiple places. That was because of the airport cluster infections. And July 20th, Nanjing reported almost, on 20th, they reported the Delta variant infected patients. So that was a panic again, because if you see before July 20th, everything was quite okay. Situation was quite controllable. But suddenly with this outbreak, so it was a high alert for the health authorities and also for the common people, you know, because recently we had the vacations and the students, most of the people, they want to travel, go out. So because of this outbreak, it was a panic again. But the good thing is that now it's quite okay. It's quite controllable. And why I'm saying that it's quite controllable, because the first batch of Delta variant patients last week on Thursday, they have been transferred to the rehab hospital. They already cured and they have been transferred there for the further medical observations. So actually, China already fought a lot in this battle, you know, since pandemic hit. So they're continuously trying hard and harder and harder. So luckily, it's controlling. But yeah, we still have cases. It's not totally over, or it's not totally controlled.
Of course. Meanwhile, Dr. Ghaffur, over in India, I understand coronavirus cases centered in the south are fueling concerns about a resurgence, as the basic reproduction number in several states has bounced back to 1 or surpassed 1 for the first time since early May. How are authorities in India explaining this worrying situation?
India is one of the most COVID-affected countries in the world. India is also one of the countries who is courageously fighting the pandemic. We had the peak of our first wave in September last year. At that time, the daily peak was 100,000 cases a year. And we had the peak of the second wave May this year with 400,000 cases per day. The second wave was not a wave, it was a tsunami of the second wave. The second wave, the rise was very sharp and rapid. And then Initially, at the beginning of the second wave, we had a crisis. The healthcare system was overwhelmed with shortage of beds and even oxygen in some part of the country. But we very quickly recovered. We improved our logistics, we improved our bed strength, and then we could manage it very well. And today we have 40,000 cases per day in a country of 1.3 billion people. Yes, the first wave last year, we managed very well. Beginning of the second wave, we had a crisis, we recovered, and thankfully we are able to manage the current caseload very well. The second wave was because of the Delta wave. And we know Delta is highly transmissible compared to the D614G of the first wave. The second wave, because of the Delta wave, the rise was very rapid. We couldn't predict such a rapid peak or tsunami of the second wave. In February this year, when the second wave started, we had 10,000 cases a day, and the peak was 400,000 cases a day, and today we have 100,000 cases a day. And we know that India has one of the fastest and largest vaccination programs in the world. We have vaccinated. We have given 500 million doses of vaccine until yesterday. 100 million Indian population, that is 8% of the population, has received both doses, and 30% of the population, that is 400 million, has received one dose of the vaccine.
Right, and that, of course, is thanks to the authorities and healthcare experts like yourself. Meanwhile, Dr. Sam, authorities in China have imposed tough measures to contain their latest outbreak. What measures are in place in Shanghai, where you are, Dr. Sam?
If I talk about Shanghai, so in Shanghai recently in this outbreak in Pudong district, we had few cases, but the rest of the situation in Shanghai is quite okay. But in response of this outbreak, so yeah, definitely Shanghai also enhances and emphasizes on the familiar methods.
Professor Zhang, back here in the studio, I believe you have a question that you'd like to ask Dr. Ghaffur, you're saying?
Yes, Dr. Ghaffur, nice to meet you. I heard that the Indian Council of Medical Research has reported recently that 70% of Indian adults have antibodies in their body. So could you tell me more about the study data, by having a 70% of antibodies in Indian adults, has Indian government changed some policy in preventing and controlling COVID-19?
Dr. Chong, that's a very, very good question, and I would like to talk about more. A recent survey by Indian Council of Medical Research found 68% of the Indian population is seropositive. Our survey, December last year, 21% were positive. That means after the first wave, 21% of the Indian population was seropositive. The sero survey shows 2/3 of the Indian population is seropositive and 1/3 is seronegative, and urban and rural areas are equally affected. That means the rural India is 2/3 of the Indian population was severely affected by the second wave. The adult and child population are affected almost equally. More than 50% of the children above the 6 years are affected with COVID-19. Now, 2/3 is positive. Is it a good news or a bad news? Let's take it as a good news. That means probably, as far as India is concerned, the worst nightmare is probably over. But that said, 1/3 is still seronegative. So we have 1/3 of the population are still waiting to be infected. Has India reached herd immunity? Because almost 70% is affected. We don't know, because with variant virus emerging, we can't even talk about herd immunity. We are expecting a third wave after a month, but we expect that third wave to be smaller than the first wave and definitely smaller than the second wave. But that may change, that prediction may change if we have a virus variant that is highly transmissible and a viral variant that have escaped to the immunity to the vaccine. So what India can do, fast track the vaccination as we are doing now, because 1/3 of the population is naive. We need to fast track the population and never be complacent. We need to follow all the COVID appropriate behavior. Wait for the second wave. We are waiting for a third wave. We are preparing for the worst and praying for the best.
Right. Professor Zhang, perhaps we could have a question here in the studio and then go back to our guests online. Professor Zhang, some pundits are claiming the herd immunity threshold estimate against the Delta variant is well above 80%. What are your thoughts on this?
Well, the herd immunity is a very tricky terminology. The concept of herd immunity is once you get a herd immunity in one society, then the people who have not immune response to any kind of infectious agent can be saved by a massive immunized people in one society. So the 70% is not a very constant number and it's not an ultimate number. The 70% is from reproduction number is 2.0. If the reproduction number is higher than that, the 70%, even though we should achieve the 70% of vaccination, then we cannot achieve the herd immunity. The reason why is that if you have a 70% of a whole population vaccinated, we presume that about 80% of 70% population have a real immunity because we have a breakthrough infection and others. So 70% multiplied by 80% equals 56%. So RO2 is one patient can infect two healthy people. So when patient meet two people and two of them has antibody, 56% has more than one. So in that case, one can infect less than one. So that leads to a shrinkage of infection in that society. So that infection should gradually decrease by having 56% of immunity. But when RO is 3, one patient can infect 3 healthy people. And when you have a 56% of immunity, in other words, 70% of herd immunity, then 3 multiplied by 56% leads to 1.6 sum. And then, in other words, 1.3 sum is not affected by, is prone to be infected. So that's over 1. So then, if RO is 3, then one patient can infect more than one healthy people. So in order to get at least 2 healthy people having immunity out of 3, then you need 67% should be immunized. That leads to at least 84% of herd immunity. 84% should be immunized before you get a herd immunity when you have RO number 3. So it's very complicated. But anyhow, we consider that the Delta virus should be somewhere in the 5 or 8 as far as the RO number is concerned. That's United States CDC reported. So the 3 is a very low number. So even though 3 is the real number, then you have to immunize 84% of the whole population. It's almost impossible until now.
I see. Meanwhile, Dr. Sam, going back to containment efforts in Shanghai, what can you tell us about the COVID-19 prevention measures there, including those for foreign arrivals to the city? Dr. Sam?
Actually, I was talking just...
Right, I'm afraid our connection to Dr. Sam right there
Sorry,
is
can you hear me?
I can hear you barely. Can you hear me, Sam? Right, I can actually hear you now.
Oh, I can hear you. Yeah, I can hear you now. Yeah. So what I was talking about that in response of this outbreak, so what Shanghai emphasizes on the preventive measures and on the other precautionary measures. So the thing is that we do have the familiar methods which were implemented since pandemic hit by WHO, the Chinese health authorities. So we still do follow those preventive measures. But yeah, in this outbreak, millions have been tested I'm talking about the nucleic acid testing. And some are like more than once. Few cities, they have gone to the partial lockdowns, and also while transport links in some areas have cut. So these were the current preventive measures to take in this current outbreak.
I see.
And as for the travelers in Shanghai, so whether they are coming from abroad or whether they are coming from the domestic, those areas which are already highlighted as a high risk or medium risk areas. So for them, we still don't have something new or specific. It's still the same PCR testing and plus 14 days quarantine.
Dr. Sam, what can you tell us about the inoculation campaign in China amid the spread of the Delta variant and the upcoming Winter Olympics early next year? Right. Dr. Sam, right, I'm afraid we've lost Dr. Sam. We do apologize for the disruption in our online connections to these doctors abroad. Back here in the studio then, Professor Chung, here on the local front, in one rather alarming incident of infection, a person who was wearing a face mask contracted the Delta variant by simply sitting in the same seat that had been earlier occupied by a person who was infected. What are your thoughts on this?
Well, this is a very rare case, and very recently the epidemiology investigation told us that there was some mistake in the communication. Those two students were taking off masks, and there was overlapping period for about 4 minutes. Even it is true that that is a very rapid transmission of infection. So we can imagine that there will be some kind of a droplet floating on air, and maybe some kind of aerosol on air. And maybe there were careless hand hygiene, like knobbing, touching the knobbing and touching their noses and mouths and etc. So, but looking at that situation, the Delta variant is a very, very contagious one. So we should be very cautious about that.
Right. And staying with the Delta variant, Dr. Sam, again over in China, what can you tell us about the inoculation campaign in China amid the spread of the Delta variant?
Well, recently, if we talk about the vaccinations and then we talk about the efficiency compared to this outbreak or to the Delta cases, so it's a bit earlier, you know, to find out whether it's that efficient or not. But recently, we had the official news from the China's very famous epidemiologist.
Right, Dr. Sam. I'm afraid the connection, we can't hear him anymore, so we'll come back here in the studio. Professor Zhang, inoculations of those aged between 18 and 49 are poised to begin late this month. The appointments will start later on this Monday. Now, having said that, do you foresee a tangible drop in transmissions?
Well, one day we'll see a tangible drop, but not in a very distant near future, because the 40% has completed the first shot, and we have only 15% completed full vaccination. Unfortunately, Delta virus is not working with vaccine with only one shot, because whether it is adenovirus vector or mRNA vector, it prevents only 33% of symptomatic Delta variant. So it is not like acting like a vaccine. It's just its only first shot. So we need fully vaccinated status of whole population. Then we can see a very significant drop in the Delta prevalence. So it will take more than a month or sometimes 2 months before we see a very significant drop because of armamented with vaccines.
Right, I see. All right, Professor Chung, as always, thank you very much for your insights. And Dr. Sam, as well as Dr. Ghaffur over in India and China, thank you very much for your time today. Right, and to our viewers here. We do apologize. We do sincerely apologize, that is, for the disruption in our online connections on this Monday. We'll be back on Tuesday with more COVID-19 coverage. Thank you for watching.